Thank you very much. Thank you very much for the nice pink garland. It's not that I don't like it, but anyways. Sorry. The Fiji Cancer Society Manager, Belinda Chen, executives of the Fiji River Dairy Limited, government representatives, stakeholder representatives, media partners, invited guests, survivors, families, ladies and gentlemen, Assalamu alaikum, Nisabullah Vinak, and a very good morning to you all. You've heard quite a lot from the previous two speakers. I'd just like to add my bit to it. And it's a pleasure to be here with you as part of the Ministry of Health and Medical Services. And I'd just like to share with you more about the need for us to create more awareness. I guess the event is all about raising funds, but at the same time, the fact that we need to create more awareness is another underlying factor to this month, October being launched as Pinktober. Okay? And so thank you very much, River Dairy. Thank you very much, Fiji Cancer Society, for the work that you've been doing. Our association with River Dairy, I think, started in 2015. And indeed, you've done a wonderful job. Fiji Cancer Society, again, you must be commended for the efforts that you have been putting in all these years to create more awareness. You've also had statistics. Yes, we've been able to reduce a few deaths, and that can be attributed to the fact that more and more women are now presenting themselves for early detections. While I was sitting there, I managed to grab hold of the packet, and sorry, I didn't have my glasses, I couldn't read the little bit there, but whatever I could read said, this can be cured. Okay? So whoever is buying this, it's very important. You just don't see the front cover of that. There's a lot of instructions given at the back. You can do self-examination, and that's the first step. If you have pain in your breast, if you feel that you have lumps, it's very important to take it seriously. And that's simple things that you can do it at your house. And then if you have those symptoms, if you have regular pain in your breast, if you feel lumps, then you need to immediately present yourself to the health centers where you have medical professionals who are going to give you more advice. To the gentlemen in this room, I think you need to be champions of this as well. You look wonderful in pink. I know pink is not a main color, but for you to wear pink and support Pinktober, I think that's a wonderful effort. And that's where the partnership within the home comes in. We need spouses to be very supportive of their wives. We hear sometimes terrifying stories about how women were abandoned when they were diagnosed with breast cancer. How after treatment there were no support, and that's enough to melt anybody's heart. So this has to be fought in partnership with organizations. Governments cannot do it alone, with NGOs. We need more people to come and partner with Fiji Cancer Society, and River Dairy just kick-started the way, and I hope to see more and more corporate organizations partnering with this, of course, raising charity as well as creating awareness, and each one of us can be that agent of change to create that awareness, because you've got to understand, when a woman's health is affected, the family's health is affected as well. Let us not see breast cancer as a woman's issue. Let us see it as a family issue. Children are affected, spouses are affected, the whole nation is affected, and we need families to be healthy. Okay, so that's to start off with. And so again, thank you very much, Fiji Cancer Society, River Dairy, thank you very much. To the survivors who have survived this, somebody mentioned it as a heartless disease, hats off for your courage. Only you know what you've gone through, and I'm sure you will be advocates for change within our Fijian women. You've also had statistics about how breast cancer affects men as well. So this is again a warning sign for men. Please don't think that you are spared by this. We have men who have been diagnosed with breast cancer. Of course, next month will be November. We will be creating more awareness about prostate cancer for men. But let us all go together with this. Let us not just October be devoted to breast cancer. We need this awareness to continue within our homes, within our community, and within the nation. So I'd really love for this initiative to continue. And so we will need to see how best we can continue this throughout the whole year, because we can't just stop in October. It doesn't mean that breast cancer will be only detected in October and that's where we stop. No, it's a life-threatening disease. It can affect anybody at any time. You've also heard about the ages. We have the youngest victim, but the theme that has been chosen for this year, I think, is very apt. No one fights alone, or no one fights alone. Yes, it shouldn't be one person fighting this alone. That's very important. That's where the support mechanisms must come in place. First, finances is one issue. But the other support mechanism must also be in place, and I can say that if you enter our, let me tell you how many facilities we have, so that you know where to go. Women need to know they can go to any nursing station, they can go to any health center, they can go to any subdivisional hospital, or they can even go to any of our tertiary hospitals. We have the divisional and subdivisional hospitals which offer 24-hour emergency services, okay? And we have a very high number of health centers and nursing stations spread across the country to give accessibility to communities, okay? So 98 nursing stations within villages and community, 84 health centers are fully equipped with staff who have the knowledge to help you better deal with this. So advising all Fijian families, I'm saying Fijian families, okay, to maximize on this opportunity, to make sure they present themselves very early. Spouses, you can encourage your wives. Men can encourage their wives to go for a checkup. It doesn't mean when the wife or you are sick, then only you go. This is very real, somebody said, and this is a killer as well. If I can give you some statistics again, we have lost lives due to cancer. And in Fiji, this is a leading cause of death. In 2015, there are a total of 136 deaths in Fiji attributed to breast cancer. In 2016, a total of 145 deaths were recorded due to breast cancer. And similarly, in 2017, we have recorded a total of 45 deaths. So when numbers come down, it's obvious that people are seeking early interventions. And that is the way forward for this. And the fact that we have lost 351 lives since 2015 is sad, because they could have been saved. They could have been saved, okay? And the fact that the 351 lives we have lost should not be just taken in totality 351. Please add the family members who were affected, the employees who have been affected. So indeed, this is very serious, and we really need to take a very serious approach to that. So today we can pay tribute to those survivors who have survived and who are living examples of how breast cancer can be fought. Okay? And I'm sure you will hear more from them throughout the month, and I'm sure that's going to have a great impact on the awareness that we're trying to create. Certain topics are taboo in our society, and I think we've broken down those barriers, and breast cancer is one. Okay? The whole idea of talking about a woman's breast is a very, very conserved thing. Nobody wants to talk about it. But if we don't talk about it, how are we going to find solutions? And it's a good thing that we have broken down those barriers and we are talking about it, and we'd like to encourage families to talk about it. And the fact, like I said, you need to present yourself for early examinations if you can't do it within yourself. But self-examination is the best way forward. Again, very simple. If you feel pain in your breast, if you feel lumps in your breast, please go to a medical center and seek professional advice. Another alarming alarming thing for us here in Fiji is that 90% of those who turn up to our hospitals present very late. They present very late. That's why creating that awareness to get people talking about it, presenting about it, self-examination is again very important. And we sort of diagnose about 250 cases every year. Okay, and somebody did mention that global statistic. In the Western world, 1 in 10 women will develop breast cancer, and this will rise to 1 in 9 by 2020. So again, early detection, self-examination. I've also said that Fijian women present very late. That's why we need you to create more awareness wherever you are, whichever organizations you have, you can do that. And breast cancer is common between 55 to 59 years of age, but you've also heard that we have a very young victim. So it can be detected as early as 15 to 19 years of age. Again, we need to encourage our girls about this issue as well. So coming back to today, River Dairy, thank you for your lead initiative in this, and the contributions from the sale of your product will go towards the Fiji Cancer Society. So encourage people to buy more of this. I'm not trying to put you in competition with other companies, but this is for a very good cause. So everybody who buys this assists in contributing towards Fiji Cancer Society and raising awareness. And like I said, this is just not milk within a packet. There's a lot of health tips at the back as well. So please, that. As we move along the month of October, I'm sure, like I said, we'll have a lot more corporate bodies joining in. Okay. And we need to have that collaborative approach to assist our patients, our families, and getting the word across to communities that we really need to be serious in talking about it. And before I close, let me close by saying that breast cancer is real. Death caused by breast cancer is real. Impact of death by breast cancer is also real to our families. So let's talk about it, let's walk our talk, and let's make a difference to whoever we can. Okay, let's support the survivors. Let's support those who are being diagnosed with that. And I'm sure the stories that we'll hear throughout the month will be enough testimony of what breast cancer can do to our small Fijian society. Okay, so ladies and gentlemen, finally I leave with something that I always say: family support. Very important. To the spouses, please don't desert your partners if they are diagnosed with breast cancer. If a woman loses a breast, doesn't mean she's no longer a woman. That's very important for us to know. Your wife is still your wife, even if she's diagnosed with breast cancer or any cancer. Like, I'm sure your wife will stand by you if you were diagnosed with anything, prostate cancer, whatever. So sickness should not take away the commitment that you have towards each other. And this is where the family support comes in. Children need to support their mothers. Spouses need to support the wives. And of course the whole family needs to work as a unit to fight this battle. And the battle can be fought. So please go for early detection, self-examination, treatment is available, and together we can save many, many, many more lives. So with these words, I wish you all the best. I'm sure we have a very successful Pinktober campaign, and let's work out ways by which we can continue this throughout the year. To all the other stakeholders who are out there, we have just kick-started with Rewa Dairy, and I'm sure throughout the month we will have many, many more coming in. And Fiji Cancer Society, thank you once again, and we look forward for a very, very successful campaign this year. Thank you. God bless.